After more than 3 years, the federal COVID-19 public health emergency expires on Thursday. While FDA and NIH officials have said that the end of the PHE will have minor impacts on their agencies, it has both symbolic and practical value for public servants. Data collection and telework will change, as well as things like free vaccines and tests for the public. GovExec reporters Courtney Buble, Katz and Erich Wagner have been covering the pandemic since before the public health emergency began back in 2020. They join me now to talk about the end of the public health emergency and how it will affect government. Welcome to the show, everyone.
Good to be here.
Good. Thanks for having us.
Glad to be a part of the panel.
We're going to do this a little bit like a reporter's roundtable, but I will address each of you first. And Courtney, let's start with you. In February, you were on our show to talk about the public health emergency. That's when we found out it was going to lapse. You noted then that this will affect the health agencies the most. How will the health agencies be affected?
So the main thing is that the Centers for Disease Control and Prevention is going to lose some of its ability to collect data from the states on vaccinations and surveillance. The White House said in a recent fact sheet that it's going to be switching a bit how it shows data. It will focus more on hospitalizations and emergency room visits, and it will still continue to collect and report on wastewater data as it relates to COVID. And the CDC has been working to sign data sharing agreements with some states as it loses that ability, but with others that didn't happen. There'll also be some changes with Medicare and Medicaid. Certain FDA guidance for industry will be impacted. And the FDA will now be limited in its ability to detect critical device shortages, but there are still some things staying the same. The Biden administration will continue to provide free vaccines and treatments for those who are uninsured, as they were getting such, with the public health emergency authorities. Some telehealth flexibilities will still remain in place. The Biden administration says it's going to continue to invest in long COVID to better understand it. And the emergency use authorizations for treatments and drugs that the FDA has given will stay in effect. And there's many other things, but those are just some of the highlights.
Eric, you cover the workforce, and you had a big story recently about what is probably one of the biggest operational changes for most feds, maximum telework and the expiration of that. How has the telework and the maximum telework memo changed feds' lives since 2020, and what's going to happen now that it is going away?
Well, we should first note that although maximum telework was introduced in 2020, there are tons of jobs in the federal government that are not eligible for it. TSA screeners, law enforcement officers, et cetera, et cetera. I think roughly half of the federal workforce had to come to work every day throughout the entire pandemic because their work just wasn't portable. But as you said, it was a big change for a lot of other feds who suddenly found themselves figuring out how telework works, how to manage their time, all these things that we all grappled with during the pandemic. And I think the data shows that federal employees found that they quite like the flexibilities that telework and remote work has to offer. Especially after those first few months where agencies were still trying to just scale up the server infrastructure and the IT equipment to make sure it all runs smoothly.
Vaccine mandates, Eric. You wrote about a Matt Gaetz bill a few months ago that addressed the circumstances of federal employees who were fired or who left government because of these mandates. The mandates were very controversial and ended up in courts since they were brought forward. The administration usually points to this 90+% rate of vaccinations were these mandates a success? And what should we think about when it comes to vaccine mandates and the administration going forward?
Well, first for the audio listeners, just want to clarify, this is a new Eric, Eric Katz here, not to be confused with Erich Wagner, who was just speaking. The vaccine mandates, I think pretty much, even though they quickly ran into legal trouble, the Biden administration did, it pretty much accomplished what it set out to accomplish. It compelled the workforce to get, like you said, over a 90% vaccination. I think the rate that they last quoted was 98% in compliance with the mandate, meaning either they got their shots or they submitted an application for religious or medical exemptions. And those were pretty much always granted with very, very limited exception. There was still, we still covered a lot, that small percentage of the federal workforce population that didn't get vaccinated and was still sort of fighting this because it posed like a major logistical challenge for the agencies to deal with that. If they actually had to go through the motions of suspending or firing. It never came to that. The courts sort of paused this before real enforcement took place. Again, at the vast majority of agencies, the mandate's still in place in certain healthcare environments like the Veterans Affairs Department. So I think that the administration pretty much accomplished what it wanted to. I think that if they had to continue implementing this, they would have it would have caused some headaches and some challenges, and I think that's probably why you saw the administration back down and say we're just going to take the L on the court case here and not try to enforce this anymore. But there's, in terms of going forward, like you asked about, the precedent is sort of unresolved, right? The administration maintains it had this right to do this, and an appellate court said that it did not, and it never went up farther to the Supreme Court. But if this happens again, depending on what administration is in charge and what their priorities are, you could see another push for a mandate and another legal battle, because I think it's unresolved.
Courtney, Dr. Rochelle Walensky is leaving CDC, an agency that she has led during the Biden administration. Friend of the show, Anthony Fauci, has retired from public service. Deborah Birx has said the country is not ready for the next pandemic. And so with some of these faces of public health, particularly at the federal level, gone out of public view, what does the future look like for pandemic preparedness and the way the administration sells the COVID response to the public?
Mm-hmm. Well, with high-profile officials departing, there's always some loss of institutional knowledge, especially with Dr. Fauci, who was in the government for over 50 years. I also want to note we also have a vacancy with the NIH director. But I spoke with some top public health experts outside of the government earlier this week, who all had confidence that qualified officials would begin to fill these positions. I know the NIH director, it's been about a year and a half now, but Walensky hasn't left yet. She's leaving end of next month. And I should also note that there is a new part of what, asking about, the country's preparedness for the next pandemic. There's also a new pandemic office within the White House that, according to Politico, the White House is having a hard time finding someone to lead it. But administration officials have been stressing that they are prepared, or they're preparing for the next pandemic, particularly with Project NextGen to accelerate the development of the next generation of vaccines and treatments. And this is through public-private partnerships, kind of like the next version of Operation Warp Speed. But the experts that I spoke to earlier this week, they also acknowledge that there is a bit of pandemic fatigue and not as much maybe political interest in it. Also, we're dealing with highly, much partisanship on the Hill when it comes to, passing legislation on it. So I guess we'll have to see if any of these efforts come to fruition. But at least what the administration is saying publicly, they are trying to prepare where they can.
I was just going to add that to that last point about sort of the partisanship on the Hill. You know, in these types of situations, we would usually see bipartisan sort of after action reports. What went right? What went wrong? What are the lessons learned? And this whole situation has gotten so politicized that it's hard to really imagine a truly sort of even look at how this played out and what the lessons are, at least as it when it comes to the congressional perspective and potential legislative needs. I think that if this happens, if this were to happen again, there would be sort of a knee-jerk reaction to people defaulting to the political fault lines that we saw in their response efforts over the last few years, and that could potentially take precedence over like what the actual sort of operational challenges or lessons were, communication lessons, even scientific and medical lessons. I think that we've sort of backed ourselves into a bad position, on that front.
Yeah, that's a really good point. And to just expand on that, there was many calls and even some legislation introduced to create a 9/11 style commission to look at what happened during the pandemic. But that basically stalled on the Hill. There have been some reviews either done by specific parties or outside experts that have said, hey, this is not going to be enacted by Congress. We're just going to take this up on our own. But I think to Eric's point, the fact that there's no review, I guess, commissioned by Congress or both sides, that could be an issue. But that's where, these outside experts come in, such as, with CSIS and John Hopkins professors, people like that, trying to fill that void.
Well, Erich Wagner, I'll bring this to you now as sort of a follow-up, because we talk about telework being the main thing that affects public servants' lives most directly over the public health emergency. On Capitol Hill, there is a very serious polarization, partisanship issue when it comes to telework, which is fairly new. How is that taking place now with the whole movement of back to offices led by people like Representative James Comer?
Well, you can see it, having an impact on administration policy, honestly. Like you said, GOP lawmakers have been sort of blaming a lot of the backlogs that built up during the pandemic, rightly or wrongly, on telework. Federal employee groups and Democrats will often, say, well, no, these backlogs were created because, people could not, they're in these antiquated systems that are paper-based. And so when the pandemic hit, they had to cut the amount of staffing that could be in the building doing that work, because, people needed to be able to socially distance while they did it. But regardless of how much truth there is to the idea that telework is hurting productivity in the government, we saw a few weeks ago, sort of preparing for this end of public health emergency, the Office of Management and Budget put out guidance on sort of how telework should function after the end of the emergency declaration. And one of the, although there's a lot of, wiggle room for agencies to just sort of pay lip service if they think telework's working really well, the main takeaway was the White House is saying that agencies need to substantially increase the amount of in-person work at agencies. And that means scaling back telework. And that it seems like a 180 because, for the past 2 years or so, OPM and GSA have both been working on, examining ways to make it easier to do telework, make it easier to, offer jobs to people who would work remotely, and sort of, uh, experimenting. GSA has been experimenting with these various, future of work concepts, whether they be, remote work environments, hybrid work environments, etc. So, you can see that, some of what the White House is doing is responding and trying to, ameliorate some of these GOP lawmakers' concerns. That also has the potential to fray some of the more collaborative union relationships the administration's been working on for the past couple years after the drag out fights that happened during the Trump administration. You know, when word came down that that this OMB guidance was going to come out, I heard a lot of complaints from not just unions but also, management groups and agency CHICOs, chief human capital officers, that they just weren't consulted on it. So it could be a real minefield as the administration looks and the individual agencies, devise new telework policies and try to negotiate them with their labor groups.
Yeah, to follow up just on what you're saying there, I think we've talked about this on the show. OPM uses the word meaningful as the operative term when it comes to in-person work increasing. Boy, there's a lot of wiggle room there. That could mean anything, and I know they're trying to have their cake and eat it too. But I think your analysis, not to sound like a cheerleading squad for GovExec, but I think you're spot on in the sense that this is such a response to the political that I'm concerned about the fights that will come forward, because progress seemed to have been made. But let's keep on the hot button topic or the hot button political note on immigration. Erich, Katz, you have written about immigration for our site. You've covered DHS and its varying issues as of recent times, but Title 42 is going to dominate some of this conversation. What does the end of the public health emergency do to immigration?
Yeah, and that is lifting Thursday, with the rest of the health emergency stuff as you're listening to this. And it's something that the Biden administration has been preparing for more than a year. I've been on so many press calls and press conferences at this point where they're laying out their various plans to alleviate what they expect to be cause a lot of strain on their resources at the border. The Title 42 allowed, it was put in place originally under President Trump. It allowed DHS to turn away most migrants that arrived at the border who, typically would seek asylum. Instead of having to hear out those claims, they would just turn them away, and citing the pandemic as the reason for that. It's been in place for a few years now, and by court order, it is ending. And they've lined it up to be on the same May 11th timeline as the public health emergency stuff. So what they're doing, because this sort of information gets out there and is sort of leveraged by human traffickers and coyotes and people like that, it leads to, historically, these kinds of policy changes lead to an uptick in the number of people who seek entrance into the country. They think it's easier or safer for them. In some ways, that's not true at all, because under Title 42, you could try to come in and be turned away without consequence. And under the new structure, there actually could be consequence. You could be prosecuted for illegal entry or attempted illegal entry. So that's actually part of the strategy here, is to try to play up that messaging. There's workforce implications here because they're deploying more resources, more personnel to the border, and trying to orient the people who are there onto law enforcement type work and not administrative work. They've boosted up their capacity to hold migrants, in their holding facilities, and they're also changing policy to make it harder for people to claim asylum by sort of revamping a rule that was in place under President Trump, modified a little bit, but the structure of it is similar in that if you pass through another country and you don't seek asylum in that country, then you are not able to gain access to asylum in the United States, with certain exceptions. There's legal pathways like parole that they've expanded, and they've created this app where you can schedule a meeting, but that doesn't always work, and the migrants don't always have access to apps and to internet and things like that. So it's kind of a complicated situation. I think the partisans on all sides sort of expect this to be messy, for it to not go very smoothly, and definitely expect the Republicans to make this a huge issue. The Biden administration failed to plan. They have an open border, and it's causing all this stress. Biden administration itself has anticipated that this could double the number of migrants arriving on a daily basis. And they're already sort of at higher levels than normal. So this could be something that's a real challenge.
I appreciate your diplomacy on this stuff. I think messy is a good way to put it, though. Boy, it's going to be, as with all things immigration, a huge set of fights, and certainly the public health emergency, if nothing else, brings a acute date to it, specifically with regards to Title 42.
Yeah,
and not to get
this. Just to add one more point, because I don't want it to get lost on the fact that this is a challenge for law enforcement, but obviously there's a human side to it too, where people are fleeing desperate situations, and the reason that there's often these types of surges is not just because of U.S. policy, but the push factors in their home countries. So managing this and dealing with it in a humane way that takes into account the needs of those people is just really adds to the challenge. And the administration is trying to walk a delicate balance here, where they can say that they're protecting the border, but also understanding and appreciating the needs of those who are arriving.
Well, and on the more personal and I guess more holistic note, and I want to hear from each of you, and Courtney, we'll start with you. You started at GovExec a little bit before all the lockdowns and the public health emergency and things like that. I'm not saying that May 11th marks the end of COVID, because I do want to be sure that our show does not endorse that kind of notion. But how has the evolution of covering this been, and seeing it, and seeing the way that the public health emergency and the way the federal government deals with this stuff, how has that changed? How have you seen it? What are your just sort of ending thoughts on it? And Courtney, again, we'll start with you.
Sure. So like you said, I joined maybe about 7 or 8 months after the GovExec, or before the pandemic started. And shortly after we started working from home, I started doing the COVID roundup, which used to be every day. Now it's once a week. And through that, I feel like I've kind of seen like the different chapters per se of the federal government's response. Like in the beginning, there was just so many concerns about PPE for frontline workers, particularly what federal government frontline workers had to do and the concerns they had. There was also a lot of allegations and just issues with political interference by the Trump administration, and them like lawmakers and others saying they weren't prepared for this, that they are bungling the response. And then we had the 2020 election on top of that, and the increase of vote by mail because of the pandemic, and there was more allegations of political interference there. And then we had the transition to the Biden administration, which came in and said, we're just going to focus on the science, listen to the doctors. But that also came to bite them a little bit, because things are kind of technical and weren't super user friendly. And then in addition to all this, we had the evolution of the vaccines and the push to get the country vaccinated, and then the vaccine mandates for federal employees, contractors, and then various waves, Delta, Omicron, and then eventually the wind down of the public health emergencies. I know I went very fast on that, and there's a lot more there. But clearly there's been many episodes per se in terms of covering the pandemic. I don't know if that's the right word to say it, but so much has happened, and yeah, it feels like longer than 3 years.
Well, one thing I noticed was sort of as we sort of like moved into like the fully remote space, some aspects, you would think that would sort of make things a little more difficult, reporting, but in some ways it got a lot easier. It made it so much easier to, try to schedule interviews. It made it so much easier to, attend meetings, whether they be in Congress or agency run meetings, because you could just hop onto another Zoom call or, a different live stream. And so in a lot of ways, it made elements of the federal government a little bit more accessible, which was kind of interesting given how isolated everyone was at the time. And, I'm hopeful that, agencies will continue to provide some of those avenues, because, there are some days where you have to pick and choose what you can tune into, and it makes it a lot easier to, cover many things when, it's all at the tip of your fingertips, and you don't have to worry about, catching a metro or a cab from one thing to another.
Yeah, I think that's a good point. And one thing I would add, as we were sort of getting some of that access, is in the beginning, when I reflect back on what it was like covering stuff in March, April, May 2020, it was probably the most emotional, and kind of raw experience I had since I've been in this job, in terms of when I was talking to sources, when they were frontline employees, and even sometimes high level officials who were more carefully trying to toe the company line. People were scared and nervous, and it was all very genuine in terms of what they were thinking about, and what they wanted to convey to me and to the public. I think as time's gone on, we've fallen back a little bit more towards people being more calculated and strategic, and that ended, as scary of a time as it was, I'll miss that window that we had into really being able to access what it was like to be working in federal offices at that time, what it was like to be worried about being able to meet the constituents' needs, of various agencies, and just sort of trying to navigate that in real time, like we all were. I was glad that we were in our little corner able to play a very, very small part in trying to illuminate that for folks. And like you said, it's not over. Still something that workplaces are dealing with, but it's certainly a sense of normalcy has definitely come back, and not always in a good way. Although of course I appreciate that we're all feeling a lot safer now.
Cases are going down for sure, and the end of the public health emergency will perhaps have an influence on that, or perhaps not. There's obviously a lot of factors here, and I don't want to give too much nostalgia to those first few months, but there was a sense of fear binding us all. Now, that may be my bubble, because I know a lot of people, when we did our project that you were all gracious enough to help us with and be a huge part of about the end of the pandemic. And when we talked to a lot of frontline federal employees and a lot of people, many of them who are outside of, I would say, my circle, were like, yeah, it wasn't a big deal where I live. It's not a big deal in communities like mine. Even at the start, they were saying that. So I don't want to paint it with too nostalgic of a brush, but it was a real cohesive moment at that moment, because I think, at least for a lot of people, it really was the fear of the unknown and the shock of this very scary thing that, you know, has taken the lives of millions worldwide and have made many, many people sick with long-term and short-term health problems. In that
Can I add
vein,
one thing?
I'll also say that it's opened up our guest list quite a bit. So now we've had people from far-flung locales and not South America and not Antarctica, but every other continent. So 5 of the 7 continents. And so for that, I'm very selfishly thankful, albeit I will temper that. And Courtney, I'm sorry I cut you off.
No, you're good. What Eric had said made me think of something else, which is that covering the pandemic in the beginning, particularly those frontline agencies, definitely taught me to be a more empathetic reporter, because we're always kind of taught like, oh, reporters like can't have emotions, it's just business all the time. But just having that like little exchange in the beginning, being like, hey, like, how are you doing? I hope you're well or staying safe. Like, that's, at least for me, that's not, being biased or I don't know, like giving a source too much, whatever. And I feel like that's something I never really like thought about doing more in my reporting, which I don't know what that says about me, but I feel like that definitely taught me more to be just more like, hey, like, hope all is well. And also to just like recognize my privilege, especially in that situation where like I could work from home. I didn't have to like really worry about losing a job or getting sick on the job.
Yeah, the before the mics get hot, oftentimes when we're recording the podcast, and particularly the early part of the pandemic now 3 years ago, one of the first things people would ask was, how are you doing? Like, how are you isolating? And it was one of those times where it changed the way we have those conversations. Because usually people just probably, yeah, I'm fine. I'm doing okay. I'm doing great. Like, whatever. I'm well. How are you? This was real reaching into one another to say like, oh, well, this is real. Like, I know, at least for me, and again, our listeners, I'm sure, are tired of hearing this, but I have family members who are medical professionals. It was very, very, very frightening at the onset, because they were really in the thick of it. And so bringing that forward, I think, to that end does change the way we all connected with one another, short-lived though that may be. And it's certainly, we're back, I think, in a lot of ways to the new normal of being very pugilistic in all forms of life. And again, I don't want to paint too much of a rosy picture at the beginning, because there were a lot of people getting into fights with like the dude at the front of the Trader Joe's or the grocery store because of a mask mandate. So certainly that has changed things. But here's to better times, hopefully, and better emergency preparedness. And thanks so much for being on the Reporters Roundtable show with me.
Thanks for having us.
Okay.
Thank you for your guidance, Ross.